Hello, my name is Michelle Yahia. This is Group 5, our case study, with Janice Tillman and Christopher Will. So our case study is ML. She's a retired registered nurse who has been given a diagnosis of stage A heart failure. She knows from her RN experience that she'll definitely be placed on digoxin as a therapy. She remembers something about halos as something to be attuned to. And pathophysiology for heart failure. A patient is high risk for developing symptoms but do not have structural heart disease. Affects approximately 1 in 3 adults in the United States. Average age is 56.9 years. Women are affected more than men at 51.5%. There's no limitations to physical or normal activity. Stages of heart failure. Predisposing diseases: coronary artery disease, hypertension, diabetes mellitus, chronic kidney disease. Predisposing factors are smoking, insufficient diet, obesity, sedentary lifestyle, drinking alcohol, and use of illicit drugs. Stages of heart failure. A rational drug therapy would be an ACE inhibitor, captopril 6.25 half tab twice daily, may be used in conjunction with a beta blocker. Short-acting ACE inhibitors, which is easily excreted from the body, increases ejection fraction of the heart, decreases the force needed to fill the left ventricle and diastolic, improves myocardial energy metabolism. Rational drug therapy continued. The next one is a beta blocker. Metoprolol succinate 12.5 mg half tab orally once daily. Reduces the activation of the sympathetic nervous system. It causes the heart to beat slower with less force. Digoxin and halos. Digoxin is a cardiac glycoside derived from a foxglove plant. It's used in the treatment of heart failure. Not recommended for stage A heart failure treatment. They're used primarily due to their action of increased inotropy in cardiac myocytes. Because of its narrow therapeutic index, therefore toxicity is not uncommon. Toxicity for digoxin. Digoxin toxicity can present either acutely or chronically. Acute is overdose, intentional or non-intentional. Chronic usually due to decreases in renal function. Clinical manifestations of digoxin toxicity is gastrointestinal upset, cardiac arrhythmias, ocular symptoms, blurry vision, photophobia, chromatopsia, xanthropsia. Gender considerations. General considerations: women are underrepresented in most cardiovascular studies. Recommendations for women are mostly based on observation from male subjects. Capoten or captopril is an angiotensin 1 converting enzyme inhibitor, which is an ACE. It's no difference of the pharmacokinetics or antihypertensive between the male and the female gender. Black box warning due to injury or death to the developing fetus during pregnancy and generally avoided for women in the childbearing years. Adverse effects is a dry cough, is 2 or 3 times more frequent in women. Topril XL or metoprolol. Beta-1 selective, cardioselective, adrenoreceptor blocking agent. Women may have higher plasma levels of metoprolol because of lower volume of distribution and slower clearance, leading to greater reductions in exercise-related heart rates and systolic blood pressure. Oral contraceptives may also alter metoprolol's effects. Heart failure education. Regular exercise 30 minutes a day. Be physically active. Walk daily. Stop smoking, vaping. Do not drink alcohol or use recreational drugs, and take medications as directed. So ACE inhibitor monitoring, such as the captopril, 6.25 half milligram PO twice daily. Blood pressure. Normal blood pressures range between 120/80 and 140/90. Renal function is the creatinine level is very important out of the renal function panel. Creatinine increases equal to or greater than 30%, or potassium levels greater that increase to 6 or greater. At first follow-up monitoring and treatment discontinuation after such changes occur. Beta blocker monitoring. This is for oral or IV monitoring. Vital signs, blood pressure, the pulse of the heart rate is 60 to 100 beats per minute. That's the normal. An ECG, if it's IV medication, every 5 to 15 minutes during and for several minutes after the parenteral administration. If the heart rate goes less than 40 beats per minute, especially if cardiac output is also decreased, administer atropine 0.25 to 0.5 milligrams IV. Daily weights are very important. A daily weight gain of 2 to 3 pounds in 24 hours or 5 pounds in a week are symptoms of heart failure exacerbation. Assess symptoms of heart failure, which is dyspnea, rales, crackles, weight gain, peripheral edema, jugular vein distension routinely. So these are the references for our study, and thank you for watching.